It's really an honor and a privilege for me to be here this afternoon presenting to everyone. As an FIU alum, I can't say enough. The program really did prepare me for the role that I serve today as a CIO. And that's not a plug, that is the truth. And anyone that I definitely talk to, I do state it. It was very timely in my career when I graduated with my master's from FIU in information systems. And I've been able to leverage that throughout my career. So I'm able to speak to my line employees. I'm able to speak to the executive teams. I'm able to really get in depth when it comes to whether it's at the most granular level or speaking to the executive team. The program really helped me, establish me to the role that I do today. And it was very timely because I became the CIO of Jackson in 2012, and it was the same time that I graduated from the program. So I was able to immediately put everything that I was taught throughout the program, throughout the cohort, in play immediately. So I definitely am one of those success factors thanks to FIU. So I'm really appreciative, and hence why I definitely want to be part of the conference, part of everything that's going on, and any knowledge and anything from an experience perspective that I could share. I definitely want to be here and be able to share it with everyone. At this time, I'm going to go ahead and share my screen for the presentation. Give me 1 second. Thank you so much. I hope everyone can see my slide. As Dr. Cousin stated, I'm Michael Garcia, and I'm the Chief Information Officer for Jackson Health System. I want to speak a little bit about Jackson. Jackson opened its doors in 1918. That top that you see there is our Alamo building. It's still sitting on the Jackson Memorial Medical Campus today. Very proud of that building, and obviously we've grown quite a bit since 1918, over 100 years, over a decade, being able to serve this community from healthcare needs and beyond. Our mission at Jackson to build the health of the community by providing a single high standard of quality care for the residents of Miami-Dade County. And that's a mission we all Jackson employees hold very dear and near to our heart. We know what Jackson means to our community. Being the only county safety net hospital. We're a large healthcare organization, we're a large hospital. We're comprised of 6 hospitals, and soon, very soon next year, hopefully we're opening up our 7th, Jackson West, which will be part of the west side of the county, near the Palmetto. Those of you that are familiar with Miami-Dade County. We're an academic center. We've been an academic center for over 50 years, very proud of our relationships with the University of Miami and FIU as it pertains to having residents and fellows go through Jackson, and it's something that we're very proud of, and obviously are able to leverage when it comes to the care of our community. We're more than 2,400 beds, so yes, we are one of the largest public health systems, but we are the largest public hospital. Our Jackson Memorial Campus is 1,550 beds, making us the largest public hospital. We have our correctional facility, so we're also responsible for correctional health of Miami-Dade County. So our inmates are our patients as it pertains to their healthcare services. And we have over 12,000 employees at Jackson, which, you know, from a COVID perspective is something that we're definitely, you know, making sure that all our employees are healthy, all our patients are healthy, and we're a complex organization. We're, you know, things that I just mentioned, we're academic medical center. So as it pertains to the number of people that are on campus, the number of people that take care of our patients and round on our patients, we're a non-for-profit safety net hospital, caring for all patients on the community, in the community, regardless of the ability to pay or not. We're the level 1 trauma center for the county, and such. We're very proud of the fact that we have our single standing building, Writer Trauma Center. In addition to recently, we were able to open up also Jackson South as a level 2 trauma center. So it's an extension of Writer Trauma that we're very proud of. We have Miami Transplant Institute, which is the largest solid organ transplant center in the nation. When it comes to volume of kidney and intestinal transplants, we're number 1 in the entire nation, and then obviously in Florida for liver, heart, lung, and other organ transplantations. The system is comprised of multiple acute hospital, behavioral health, rehab, primary specialty care centers across our county, urgent care centers across our county, long-term care facilities, and our correctional health that I already spoke about. We're high acuity level patients. We care for the sickest and most complex patients in the county. And thus, when it comes to COVID, each one of these points is extremely valuable when it comes to the complexity, because since our patients from an acuity level are the sickest and most complex, such as trauma patients, such as transplant patients, we need to make sure that these patients are very well protected, because their ability to be infected, their ability to be compromised is extremely sensitive. So now I'd like to speak a little bit about the Jackson COVID-19 digital transformation journey. And time was of the essence. Time is still of the essence for 76 days into our journey. And as such, I want to concentrate on some of the things that we had to do from an information technology perspective. Initially, early on in February, as the pandemic started growing, we wanted to make sure that we were ready. We're ready from an operational perspective. We're ready from a patient care perspective, but were we ready from an IT perspective with our systems? So starting in March, as we received our first patient, it was obviously very difficult, the fact that we actually had our first patient, but we needed to plan it, and we need to make sure that we made the appropriate changes to our EHR, our electronic health record, that we were ready from a presence from a telehealth perspective. Data and innovation. And innovation could have been something that's new in the industry or new to Jackson, because of the fact that this was really on you for everyone. And cybersecurity, obviously a lot of folks were trying to take advantage of the fact that the curiosity to send an email to somebody, let him know what's going on with COVID, and at the same time possibly infect an organization from a cybersecurity perspective. So those are kind of things that we need to make sure we're keeping up to date from the very beginning. Some of the immediate modifications that we had to do, and luckily we had an executive governance task force from the beginning led by an infection control team to really start governing what are the changes we need to make, because in a pandemic and something that's so new, so many individuals had great ideas. Why don't we do this? Why don't we do this? We should do this. We should do that. But at the end of the day, we needed to make sure there was governance on over the priorities that we needed to go tackle, and to make sure that everyone thought of all the outcomes and consequences based on the changes that we're doing, changes we're making on the fly, to adhere to everything that we need to do to safeguard our patients, our visitors, and our employees. So we had to make many changes to our registration systems. We spun up tents at each of our facilities. So those are new locations that we had to make sure that patients were being registered appropriately and accounted for. When it came to scheduling patients, many of the patients that would come on site to have on-site scheduled clinic appointments, now we're handling them remotely. So scheduling had to change. Many things were being canceled. If things weren't urgent, we wanted to make sure we weren't exposing our patients unnecessarily for the need to come on campus. So a lot of changes needed to occur during registration and scheduling. And then we had to create new patient and employee screening questionnaires and workflows. We needed to screen our patients. We needed to know if they had traveled initially. We needed to know if they were symptomatic or asymptomatic. We needed to know if they were in contact or felt that they were in contact with somebody that might have potentially been positive. So we had to address screenings and then workflows based on the way they answered your questions. So workflows from a business operational perspective and workflows from a technology perspective. So there was many things and processes we needed to build in our EHR to account for those workflows. And then identifying patients that were under investigation, PUIs, were they high risk, low risk? And once that we had a confirmed positive COVID patient, how were we going to address those patients? How were we going to isolate them from other patients? How are we making sure that our employees were protected when they were dealing with these patients? Those are all things that we had to do. So we had to build rules. We had to build flags. So when someone could potentially be dealing with a high risk potential patient or a confirmed case, we knew, and we knew how to deal with the patient, and we knew how to protect the patient along with protecting ourselves, being frontline employees at this time. We had to build new locations, orders, care plans, order sets, rules, alerts in our EHR that didn't exist prior to COVID, but exist today because of COVID. And those are a lot of lessons learned, because if this is the first of many pandemics to come to us, or surges that'll come in the near, this is all built, ready to go at any given time. We also we're lucky enough at Jackson Health System to be able to acquire lab analyzers early on. And because of that, we were able to start testing our own patients, to start testing our own employees. But all those lab analyzers needed to be added to our EHR. Interfaces had to be created, so the results wouldn't be handled manually, that it would all come discreetly, electronically, as fast as possible for us to be able to know and treat these patients as soon as possible. So a lot had to be changed with our EHR. And along with our patient accounting solution at the back end, we need to make sure that everything's synced up. From a telehealth and video conferencing perspective, Jackson was lucky enough to have signed a contract with Zoom early on the prior year. So we were already on the Zoom platform. Jackson owned our own instance, which is Zoom's healthcare version, which is a secure end-to-end encrypted. We don't allow any kind of recording, so there's no interference between that end-to-end connection from a security presence. But we dealt with Zoom and a solution we already had for patients from an observation perspective. So it was our Cerner EHR patient observer solution along with Zoom to be able to take care of our inpatients. Our PACS team quickly put together carts with cameras and monitors to be able to have communication with our patients to minimize the exposure needed when we were dealing with a patient, to not have to waste PPE going into a room just to have conversations, if we had other means of ways of communicating with our patients when there were, imagine, no visitors, alone in the rooms, wanting information, wanting to communicate with somebody. We came up with ways to be able to do that for our patients. Also, moms with their babies in their NICUs, we came up with solutions for the moms in the that had their children in the NICUs, their newborns in the NICUs, to be able to see them and be able to have some kind of visual contact with their babies as they were born. So luckily we had the solutions in place that we repurposed, because at this time purchasing equipment from vendors was very difficult. The entire world was purchasing cameras and laptops and computers, so we had to make do with what we had. And I feel we were very successful in doing so. Another thing was our outpatient visits. We were able to leverage them also when it came to e-visits. So patients that had ambulatory visits or urgent care visits that not necessarily needed to come on campus, we were able to take care of them remotely through the use of telemedicine. That's been working out great and continue to leverage, and we'll continue to leverage. But as now we are at the other end of the bell curve when it comes to the virus, we want patients coming back on site. We understand now what we need to do from a cleanliness perspective and making sure we're sanitizing our organization. Employees know now how to gown and don PPE. Everyone wears a mask, whether it's a visitor, whether it's an employee, a patient. So we're much better suited today to be able to start the new norm of patients coming back onto the campus. But where we can leverage, obviously, telemedicine, telehealth, we want to continue leveraging that through e-visits. Remote users working from home, that was something huge, right? The workforce, we didn't want folks coming on campus if truly they didn't need to. So non-essential employees that could work from home, we wanted them to be able to work from home. And many of our employees, if they were working in an ambulatory clinic or if they were working on units that now had less volumes due to the fact that now heavy concentration on COVID, heavy concentration on the crisis that was going on, some of the non-essential areas, those employees were able to leverage and work remotely. But from a technology perspective, we needed to make sure we were able to take that on. From a bandwidth perspective, from our VPN appliances, from a security posture in our applications, luckily, we were able to take on that huge amount, over thousands of users being able to connect securely to Jackson and continue performing their work from home. And then just meetings. From a video conferencing perspective, we always leverage video conferencing, but now in a totally different way. All meetings are now basically on virtual. Even if you're on campus or at home, we're trying to keep social distancing. We're trying not to put a lot of folks in the same room. trying to keep the 6 feet apart from each other. So in doing so, we're conducting meetings virtually, everyone signing on, using video where we could actually see each other's faces and feel that we're in the same room without needing to actually be in the same room together. Some of the additional things we've done is conducted town halls where we've had over 1,000 of our employees in our town hall meetings, being able to ask questions, being able to be on a live stream to know what's going on in the organization. We want to make sure our leaders are communicating to our frontline employees in our town halls, and any questions that they might have, we're able to address and answer in real time, and if not, get back to them later. So we've been able to leverage all these things. Some of the things that I'd like to show you, this is an example of our telehealth patient observer solution, where we're seeing the vital signs of the patients, knowing where they are, trying to understand now through video, communicating with the caregivers that are using the PPE inside the room along with the patient to make clinical decisions in real time, understanding if a patient needs to be on a ventilator, understanding if a patient needs to be intubated, extubated. We can make all those decisions along with communicating with folks in the room without having to put on and don all the PPE gear and try to conserve as much PPE as possible, at the same time, protecting our patients, protecting our employees. So we felt that this solution has been working great for us. Another example is we utilized our Zoom experience and meetings and video conferencing to celebrate. At May 15th, we're celebrating having 400 of the patients that were inpatient successfully discharged out of our hospital, sent back home or wherever. And at the end of the day, the employees really enjoyed it. We had participation of about 1,000 employees, and in different facilities, we set up areas where our employees could listen live, and we also did record this session to make sure that anyone that didn't get to participate while it was going live, that they could see it afterwards. Many shout outs to different departments. It was a fun event, and just to celebrate, we've been going through a very rough period, and I think it was time, and the organization felt that it was time to celebrate. So luckily, IT was able to participate and make it possible for the organization to participate through that. Next was data and innovation. When COVID hit, everyone needed to make real-time decisions, and the only way you're going to be successful in making the right decisions is having the data. But having a bunch of spreadsheets wasn't going to cut it, right? So we needed to make sure that we had the appropriate data visualization tools to provide the data as needed for folks not to be able to be looking and fetching for data, but data was being pushed to them in near real time to make those critical decisions, along with the creation of apps and tools that didn't exist prior to. We had to innovate, we had to get creative, and it had to be quick. It wasn't one of these things that we say, yeah, we're going to do that in 3 months. We'll be able to provide that to you in 6 months from now. It had to be within days or a week. And luckily, we were able to provide those, which I'll share with you. In addition to patient surveillance, leveraging technologies that we have today in the organization, we're monitoring the behaviors of patients and as they flow through our organization, and leverage AI where we could replace human repetitive efforts with AI, with the machine really doing those efforts to alleviate staff from being able to really do what they need to do, and it's take care of patients. We started our own predictive modeling at Jackson for our own patient population, since we felt we were pretty diverse, knowing that we had long-term care facilities, knowing that we had to take care of correctional facilities in addition to patients in our community. So we need to understand from a surge possibility or a recovery effort what we were looking at based on real data. So I'd like to explain a little bit about that. In 2012, Jackson decided from a data strategy perspective that we didn't want to tie two things to any of our applications or vendors, current vendors. We wanted to be vendor agnostic when it came to our enterprise data warehouse. So we built our own enterprise data warehouse. It's in near real time. In some cases, we could provide data within 2 minutes or near real time. And then we felt the same thing when it came to our enterprise integration engine. We needed data in real time. And when it comes to healthcare, we're lucky that we have a standard called Health Level 7, HL7. that we can communicate to downstream systems from source systems within milliseconds and thousands of transactions. So because of that, we needed to satisfy the different types of data requests we were getting. Many that were patient related and many that were based on organizational availability. What we would be able to take on if a surge were to occur. So from a patient-related perspective, we needed to know the total number of patients that were tested versus the number of positive COVID patients. That percentage is very important. Next, we needed to know how many patients currently were admitted in our organization that were positive or PUIs for COVID. We needed to know how many of those patients were in intensive care units. We needed to know how many of those patients were on ventilators. So we needed to know utilization and what we were dealing with. How many new COVID patients were we getting on a daily basis? And how many were we discharging on a daily basis to make sure that the numbers that were going out can manage the numbers that were coming in from a capacity perspective. On that note, from a capacity perspective, we need to know how many beds were being occupied versus how many were available and how many would be available if a surge would come on, whether it was an acute med surge bed or an ICU bed. And beds that would be able to be converted to an ICU bed if needed. How many ventilators would be available? How many anesthesia machines could we turn into a ventilator if needed and would be available, along with supplies? How much personal protective equipment, PPEs, that we have available for our staff, for our visitors, and for our patients as needed when it came to making sure that we had adequate amounts of things. So these are things that we were reporting, whether it was to the county, the state, federal government on a twice a day at times. Now that we're on the other side of the curve, we've really been reporting once a day. I think now we're obviously in a better state than we were originally. From a data visualization, once again, we didn't want to be looking at spreadsheets. So we leveraged Tableau, we leveraged the power of our enterprise data warehouse to be able to produce data. This is just one example of many of the dashboards that we have. This is just indicating the last 2 weeks on where we are, what's the current activity for the organization, overall testing, number of patients in the ICU versus other floors, the types of patients, whether female, male, ethnicity, race, and then from a geo perspective, in South-Dade, Miami-Dade County, where are these patients coming from? Where is the population segments within our region that these patients are coming from? And from a data integration strategy perspective, leveraging our enterprise integration engine, interface engine, we're able to centralize all data flows, exchanges. Data is organized and standardized for maximum versatility. Because of this, we've been able to reduce development time and maintenance because we try to repurpose everything we do from an integration engine perspective. And we're creating data as an enterprise. We really leverage the enterprise service bus and data as a service, utilizing our engine. Advances integration capability. The integration engine is a development platform for us. And we've been able to leverage that to do a lot of custom, homegrown things at Jackson. And it's fully integrated with our enterprise data warehouse. So whether we're feeding data into the warehouse or we're extracting data from the warehouse to feed other information, this data is flowing in real time through our engine. And our engine, it has its own database. It has its own cache database that we can leverage to do many things with, that I'll explain some of those stuff. So one of the things we've done at Jackson is something that we call Overwatch, and that's our patient surveillance system. So it's uniquely designed, and it's won a couple awards for us from an innovation perspective. And it's been designed and developed 100% by Jackson. And I'm very proud of our entire IT team on how we look at things where can we do it ourselves, or do we need a vendor, or do we need partners? And these kind of situations, we've been lucky that we've had the internal team and we've done the things internally. So we were able to provide the organization what was needed when it was needed during this crisis, during this pandemic. Our Overwatch solution is enterprise data platform built directly above the integration engine. It's models data in transit, turns data into an asset for us. As I stated, it's a data as a service. It's not an application. It's capable of accessing our interfaced application, data feeds, and more in real time, as I spoke in reference to HL7 and other ways that we are capturing data in real time and able to provide it for everything that we're driving. Specifically when it came to COVID, this was essential for us. It tracks the most important information, establishes data-driven relationships based on our patient population, and takes action based on dynamic workflows that we've created, and as it's observing, as it's surveillancing everything that's going on between our systems and applications. Because of Overwatch, we've been able to build a module called Outbreak, which is essential when it came to COVID. Our Outbreak module identifies patients under investigation and tracks their status. It leverages data as an asset in real time to power AI. Automation of human work is 100% accurate, and we're able to leverage that so the human doesn't have to do it. Leveraging and processing data as a human would to notify and communicate information quickly to rapid impacts and faster turnaround times. It's able to support and handle complex decision trees to navigate data and make decisions. And the nice thing about it, since it's tied to our database, it can remember important things to be used in the future if necessary. Things that we're currently doing with Outbreak is results are read in real time from all the interfaces, from all the analyzers, and determined to be positive or negative. This helps us to be able to communicate with our care providers. It supports the results from both internal and external labs, since Jackson was one of the few hospitals that had analyzers at the time. We wanted to make sure it wasn't only for Jackson. So we built relationships with other hospitals to see if we can help them if they were going to take on a surge or they couldn't handle the volumes. Because early on, when it came to Quest and the Department of Health, it would take days to get results. So if we could help in any way our community, we wanted and build it to do so. So we built those interfaces with partnering hospitals in our community. Notifications were sent to clinical and hospital leaders to allow for rapid deployment, whether we needed to isolate patients or just give them the relief that they were negative, or if they were positive, how were we going to do without these care workers having to constantly be checking the medical record, the EHR. Are they positive? Are they positive? Are they positive? We were able to notify them in real time the moment a result would come back. No additional responsibilities on the workforce needed to facilitate the use of the data and the intelligent alerting that we were able to create for them in real time. And then now, because of the surveillance capability and leveraging Overwatch, we want to correlate positive patients and now start looking at their location history for contact tracing. What we want to be able to do and leverage is now that a patient that might have been asymptomatic or came into our organization through the ED, visited several different areas where the ED held an observation, went to radiology, and was placed in a room, we could backtrack and know exactly all the locations where those patients were to understand what rooms were exposed, what employees were exposed, what potential patients were exposed. So we're excited everything we're doing from this perspective to be able to sort of understand why certain things are going on in the organization and leverage technology to do so. Some of the tools and apps that we had to create was an employee screening. Not only were we screening our patients when they would come in through either a tent, an ED, an urgent care solution, but we need to screen our employees. Was it safe for them to come to work? Was it safe for our patients to be seen by our employees? So our employees will need to fill out a questionnaire. So we built an app with a questionnaire to see if the employee was a candidate for testing. And in addition to those results, and were maintained in this application that we were able to track at the moment that those employees would either become positive or negative if they were symptomatic, or they had traveled, or they had come in contact with somebody from COVID. And so we took special consideration because we needed our workforce, right? So the first thing we needed to do is how fast can we let employees that were asymptomatic and negative know the results so they could come back to work. And by doing so, we're able to relieve the lab staff and others from having to call the employees to let them know the results. So if an employee was negative, they would receive a notification letting them know they were negative, and they would be able to come back to work and be redeployed as soon as possible. If an employee was positive or the result was inconclusive, those will be communications, those will be calls that we would have with the employees to understand next steps and what needed to be done to take care of our employees. At that moment, it became our patients. But having these kind of tools alleviated the need for employees. We automated, used AI, used Overwatch, used Outbreak to be able to leverage and constantly communicate in real time with our population. And then we created a tool for workforce redeployment. As I stated earlier, many of the employees were sent home because they weren't essential. And at that time, we needed more nurses. We needed more staff and talent in other areas of the hospital that were heavily being impacted by COVID. So because of that, we felt that we needed to create a tool where employees could assess their talents and where they felt they could be utilized during this time. We wanted to make sure we retained the talent and used our internal talent within the organization instead of outsourcing talent. If we had employees that weren't being maximized or weren't fully being utilized, how can we fully utilize those employees? So some of the leaders and managers would provide talent. They'd say, I'm using this employee only half of the time, or I'm not using this employee because of the non-essential and needing to work from home. How can we repurpose that? And then we would have leaders and managers that would request talent. I need this type of talent. I need this individual for these days, these hours. And our great HR team would match the talent. We would look at and assess the skill sets of the employees, the talent that was available, who needed it, only match, and then schedule those employees to help in those areas of the time of need. We were able to build this tool in a matter of days. That's been essential for us in repurposing our employees. And then from a machine learning perspective, we felt that needing to predict surges and recovery efforts. We've called our tool Pegasus, and it's an in-house design machine learning environment based on Anaconda, utilizing Python. And the machine learning models we use and created due to COVID was an SIRM model: susceptible, infected, and recovered. And in our case, removed, right, population. And it's extremely custom tailored to Jackson and for our patient population. We added a layer, not just of all tested patients, but really hospitalized patients. We wanted to understand what was going on, as I stated earlier, in our ICUs, on our beds. We needed to understand if we were going to take on a surge, what would that look like? And we needed to track patients on a daily basis versus discharged patients on a daily basis. So we start the recovery efforts if we start realizing that now we're not taking in as much as we're taking out. So multiple models were used. And the reason for that is because of all the changes that occurred in policies for social distancing in our communities, our stay-at-home initiatives and orders through the county. So models outputs are combining all those in a continuous curve. So when different points occurred via policies in the community, we adjusted the model for that in a continuous curve to once again forecast the surges and recovery efforts. The way we did the model is we trained it on the 80-20 split model, split of data approach. 80% of the train was used to train the model, and then 20% was used to test the model. Testing patterns for COVID had many peaks and valleys specific to Jackson because of long-term care, because of our correctional facilities. So at times we would bring huge amount of inmates or long-term care facility patients and see if they were tested positive or not, just safeguarding all the residents in those areas. So we would receive spikes at times if we had a huge testing initiative at either of our correctional facilities or long-term care facilities, as you can imagine. Some of the stuff is here. We have many models, many different displays, but this one is a combined daily model based on our inpatients that are positive and our discharge patients that are positive, and trying to predict versus actuals. And we felt our models have kept consistency, which with the realities. As you can see many peaks and valleys, but at the same time, the first one here is really tailored to our inpatient population and admitted patients that first hit us hard at the beginning, and now we're on the other side of the curve once policies and everyone has been more or less protecting themselves in our community. And then we see our discharge population, which was much slower at the beginning, due to the fact that we're taking in patients and there were more severe, more acute patients. So the difference in the graphs, you can see that we've maintained from a length of stay patients, some patients for a very long time in our organization, but now that's narrowing down, and we had the break even, where now the amount of patients we're taking in on a daily basis is less than the amount of patients then actually we're discharging. So we're discharging at a higher rate. Thus, the curve is going down, and eventually, this is a 5-month model. And if the predictions continue to occur based on the model, we should be in a very good situation come the August timeframe. And cybersecurity, as I spoke earlier, this is a feeding fest now for hackers to take on the pandemic, to spike curiosity from users. So it's not only an IT issue. This is everyone that has an endpoint. And in today's world, realistically, with cell phones, with your computers, laptops, with your tablets, everyone could be vulnerable. But a healthcare organization is more vulnerable because a patient's medical record is more valuable than any social security number, any credit card information, due to all the fraud that can be committed, because a medical record does contain a patient's social security number. And unfortunately, so much fraud occurs in healthcare that hackers know this. And if it's not because they want to steal the patient's information, it's because they want to hold it for ransom. As you guys know, many healthcare organizations have been hit with ransomware. And at times, if the organization didn't plan for it, didn't have the appropriate backups, they've had to pay those ransoms, unfortunately. So at Jackson, we take cybersecurity and IT security very seriously. Our assurance team safeguards us using behavior analytics tools to understand patterns and behaviors of all the devices on our network. And when one of the devices start acting sporadically, where it's not behaving in its norm, sending packages that shouldn't be sending to locations that it shouldn't be sending to, those are the kind of things that we pick up and are able to immediately take action on. Leveraging biomed, hackers know that not all biomed equipment can be updated with the latest and greatest patches. They have to go through a rigorous testing because patient lives are attached to it. So because of those, hackers are able to leverage trying to exploit biomed equipment in healthcare organizations. So we through our behavioral health tools, between us having firewalls and solutions protecting these equipment, is the way we're able to safeguard, and luckily we haven't been harmed in a severe manner ever. But it's everyone's job. The first thing is education, right? Security awareness is your first line of defense. Every single one of your employees need to know. And how do they need to know? They need to practice. So we do all kinds of simulation activity, from phishing expeditions where we'll send phishing emails to employees to see if they'll put in the username and password, because it only takes one. And if someone does, we educate them and let them know why it's so important for them to be thinking and look for signs where, is this a legitimate email from our CEO, or could this be a potential hacker? And letting them know that a lot of the social engineering initiatives go through social media, go through phone calls, go through in-person physical contact. So it's not just worried about that phishing email, but many other ways that hackers utilize to try to get information, to try to be able to get into our systems and exploit the opportunities that they're given. So one way to do that is constantly patch management. You need to make sure all your devices are patched. It's the only way you can protect the organization from the known. Now, protecting it from the unknown, we feel using behavior analytics is the only way we could protect it from the unknown, because the value of what the hacker is doing, if they find it to be valuable, they're going to hit you with something that's unknown. So the only way truly to protect is understanding behavior patterns. But the use of multi-factor authentication or two-factor authentication is very important, because if an employee does fall for one of those emails, someone phishing for credentials, a username and a password, just the username and password alone will not let someone come into our organization. We use multi-factor authentication or two-factor authentication, and many times to be able to add an additional layer of complexity for someone that could potentially have a compromised username and password of one of our employees or one of our users. And restricting the amount of downloads and access to unauthorized sites and applications to our endpoints, to our company-owned Jackson equipment is very important. All our equipment is encrypted and all our equipment is protected and managed, so unauthorized applications aren't, and obviously through our firewalls and other solutions, we limit the amount of exposures that our equipment can be accessing unauthorized sites. It's our efforts, but security awareness, and it's really truly your frontline and educating your staff all the time. With COVID, this has just made it much more complex. Just an example of what we do with two-factor multi-factor. Anytime one of our remote users tries to access our VPN application, once they put in their username and password on their cell phone, they get a message saying, "Is it really you?" kind of thing, where they accept or deny. If they accept, now at least we have two methods to verify the user, verify their password, and verify from their device that it's truly them, and then they gain access to the system or the application. Just wanted to share one example on how we do that to really protect and not only rely on usernames and passwords. I know I've said a lot, and at this time I'd like to ask if anyone has any questions, and I'll obviously turn it over to Dr. Cousins. It's been truly a pleasure and an honor to be able to present to you guys today and this afternoon.
Wow, what a fascinating story of the journey of a CIO through the pandemic era. And so much agility and innovation took place during that period. So thank you, Michael, for sharing the lessons learned and be so open about some of the proprietary solutions that were created out of the Jackson Health System IT department. So at this point, I'm going to invite the audience to ask their questions using the Q&A feature. And I'm going to just go there now to see what the questions are. So first question from Shanjun. Due to COVID-19, lots of adjustments needed to be made for hospitals. As a CIO, what have you done to control the budget? Did you have to reallocate funds to fund some of these new innovations?
Luckily, since everything was utilizing tools we already had, it was really, COVID froze our existing projects and our existing implementations. At the end, I'm sure there's going to be a total cost of ownership where we're going to end up paying for it later. Yeah, from an impact, we were hit financially hard due to the fact that many of our employees, as I said, we had to redeploy them, but they volunteered PL time, their vacation time, because the organization didn't really have any incoming revenue. All the revenue that was coming in, as you guys know, revenue from COVID, there isn't any. So initially, we were absorbing a huge amount of loss. Luckily, the county, federal dollars have come in to help Jackson during this time of need. But we were taking a hit as much as $25 million on a monthly basis when COVID started, due to no one having elective surgery, no one coming into our institution, no one going to their appointments. So there was no income, but there was a lot of expense. From an IT perspective, since we didn't partner with any vendors, since we didn't reach out and emergency sign a contract for a VPN appliance or a server or increasing any type of utilization, we've been able to maintain it because we had already planned and set our information technology solutions a long time ago. But for organizations that didn't plan, I heard about organizations running to increase their VPN appliance, their licensing, their bandwidth, and many of them in ways had to look for not the most secure way of having remote workers connect to their organizations to be able to work remotely. Us at Jackson, luckily, we didn't have to go through those scenarios.
Thank you, Michael. Next question concerns the analytics capabilities that you have at the Jackson Health System. Did you have sufficient human resources in order to begin your own predictive modeling and tracking this data, or did you have to outsource?
No, we did it all in-house. And if I was to tell you the number of resources we have, in the IT division at Jackson, we have 250 FTEs. And with those 250 employees, we're able to do everything we do on a daily basis. We don't have a consulting company working constantly at Jackson. It's all held within our own FTEs. And those were the teams, those small teams were the ones that, as we like to say, miracles made daily. We come together as a family, and we just put our skills, our talents together and leverage that to come up with the solutions that we do. So at Jackson, we put together a solutions team, and that solutions team comprises of multiple disciplines within IT. And that way we could bring the brain share kind of together to be able to come up with the solutions that we do from a data perspective.
So throughout your talk, I noticed you mentioned several proprietary applications: Overwatch, Outbreak, Redeploy, Pegasus, Cybersecurity.
Yeah.
Well, that's not.
We get creative with the naming.
Very creative with the
our
naming.
director of data integration comes up with amazing names for our solutions, and they are truly 100% Jackson solutions when we name a solution, and we're very proud of them.
So some of these solutions were developed this year very quickly. What factors helped you to make these changes in processes and operations so rapidly?
In our environment, the days of performing an implementation or an upgrade once a year doesn't exist, or on a quarterly basis. We're constantly in an evolution of change. So our team is very dynamic and fluent in being able to make changes. In healthcare, especially with everything that happened from a meaningful use perspective and promoting interoperability right now, the demands, regulatory requirements, we're constantly having to change. And at Jackson, being level 1 trauma, we do change well. We do firefighting well. That's what we do, and we've done it for 100 years. So very proud to say that when we're challenged and we really need to come up with solutions for our community, we're proud to say that's what we do on a daily basis, and miracles definitely do occur at Jackson.
So that's from the IT side. Was there any user resistance to this fast pace of change?
No. Typically, change is something that's very difficult. The one constant is change. Folks don't want to change. But in this, everyone understood. Everyone came together. Everyone from the top, our CEO, and if you read in the paper, our CEO was COVID positive. So it was very near and dear to us, understanding that Carlos himself was going through this. Luckily, he was asymptomatic throughout the entire process, and he never needed to be hospitalized or anything happened to his health. But at the end of the day, I mean, when your top leader is COVID positive, it really brings it into play. And whatever we need to do, we need to make sure that we're going to be ready, not only for him, but our entire community.
Wow. That certainly is a noble mission, and a lot of motivation to contribute to this crisis in this way.
Everybody came together. You never heard, "It's not my job.
Yes.
Not what I do. This is what do I need to do to help?" And that's why creating that redeployment tool was so essential for us, to be able to redeploy staff that would be able to be redeployed.
Okay, so a question here from Maria Rivera, from an MSIS student who sent a message to you, by the way. She says, thank you for an insightful presentation. As a student, I'm inspired. So that's great. So her question is, in the context of your role before and after COVID-19, what are some of the new discoveries that you like to keep and the things you'd like to do without going forward, and why?
Well,
So things you want to keep,
I think we want to keep it all, because you could always get a tuberculosis patient. Patients in isolation have always existed in healthcare organizations, but they weren't your majority. It wasn't the only thing you were focused on for the last 3 months. But everything we've done, all the initiatives we've done, I guess this crisis helped us to think of things we hadn't and lessons learned. Where we said, why didn't we have this? Why didn't we plan for this? Or why, knowing that it could have always happened. So I think for us, it happened at the right time, if you could say that, through this crisis. Because if it would have happened, let's say 5 years ago, we would not have been able to, from a technology perspective, been able to do the things that we're capable of doing today. Not only have we planned for the resources and leverage those resources, but the human resource. My team is small, but I have an amazing team from a technology perspective. They obviously make my job a lot easier. I think I'm able to communicate with them due to being a graduate from FIU and MIS recently. It's not like I graduated in the 90s. So I'm able to stay relevant, but they're the ones that really drive. They're the ones that make the magic happen. And educating throughout the years our business owners, educating our executive team. So they're able to speak the lingo as much as I can. And that's really been valuable. So when we start coming up with a plan, when we talk to our CEO, when we talk to our COO, when we talk to everyone in our organization, and at Jackson, our CFO is our Chief Innovation Officer. What stronger power than our CFO leading the efforts from an innovation perspective? So a lot of times innovation gets trumped either through culture or through financial. And having our CFO support us from an innovation perspective and understanding the whys and the buy-in that we get is crucial. And it has made Jackson much more successful from an innovation and technology perspective.
Certainly fascinating. So I have a question about cybersecurity. And did you experience more cybersecurity attacks during the pandemic?
The amount of phishing emails with COVID, tremendous amount. But from an attack, I wouldn't say an attack, a possible attack, no doubt. We're always getting attacked, but we've seen the volume of phishing emails and enticing people. Huge COVID this, COVID that, get the latest data, get the latest this, just sign on here, we'll send you information, just put in your credentials. And luckily, we blocked most of that, and through education, we really haven't had an issue from that perspective.
So there's a question earlier on about whether or not the Jackson Health System is developing a vaccine. And if so, did your department play a role in providing any service to that team? So
a lot of this has been a trial, right? So everything's a clinical trial, from the medications that we're giving the patients to treat them, everything. So we do have and work with our partner at the University of Miami on clinical trials, on research, as it pertains to everything that's going on with COVID. They're really the ones trying to help in this world on how to treat patients in our community and come up with solutions to hopefully come up with a vaccine or other. So many individuals are really trying to help and find a cure, find a vaccine, because we know that during the summer times it was predicted that this will slow down. We don't know when the winter comes if this is going to pick back up.
All right, so there's a question about regulations. How did you communicate the changes with all healthcare providers and make sure that all new regulations are implemented?
Yeah, first, kudos to our teams from top bottom, especially our infection control team, our emergency management team, our leaders. We've been in constant contact with our governor, our commissioners, our mayors, to understand what is being and how this is being regulated, what we should be doing, what we shouldn't be doing, understanding all the laws and the loosening of some laws through the time of COVID, due to the fact that it's about the patient. So constantly thinking about the patient's privacy in mind, but their well-being. It has helped us, but we've been in constant communication and understanding. Now, change management is not change control for us. We have our change control process when we're going to do an update, an upgrade, and make sure that our change controls are there. But from a change management perspective, we have an amazing change control director by the name of Kelly Kelly Jackson, but she got married, so she's now Hernandez. So Kelly Hernandez leads our efforts from a change management perspective and constant communication with our leaders. As a matter of fact, now a lot of the efforts that are going on is what did we learn? And as somebody asked the question before, what are we going to keep? What are we going to stop doing? What are we going to start doing? What are we going to continue doing? So from those kind of perspectives, change management at Jackson has been a key role, and we've known early on that we needed it on how we're going to communicate why we're doing what we're doing. Because when an employee understands the why, you get the buy-in and they understand, and everyone comes together to make sure that we accomplish what we set to accomplish. We get the outcome that we want to get. If you don't understand the why, I don't understand why I got to click that extra click. I don't understand why I need to do this new way to my job. So getting that buy-in is essential.
Yes, wow. Certainly a lot of questions today. You really stimulated the interest of the audience. Okay, so next question. In the predictive analytics that you carried out, did you identify any main bottlenecks in providing care? And was this information used by management to anticipate solutions?
Well, we look at all the data. We know that it's early on, and especially at the beginning, our models weren't as good as they are now because there just wasn't the amount of data necessary to be able to truly predict. But we've been using all the data and communicating all the data with all the officials to make sure that we're on the same page. But as things changed, the huge surge at the beginning was because no one was social distancing. There was no stay at home. So folks were still carrying on as they normally did. Hand hygiene wasn't being followed. So we saw a surge. And in our models, we definitely saw the moment that the stay at home, the moment that people started really taking care of themselves and taking this seriously, that it started decreasing, and the model started aligning, and the actual data started aligning with the models. So we were lucky in that, and we've used that to make decisions in the organization. But it's not just about the modeling; it's really about having real-time data, knowing and getting a message. This patient is, even though they were asymptomatic, didn't have any symptoms, is positive. Mm-hmm. We need to react quick, because we need to understand that the potential of that patient reinfecting another patient, or that patient possibly exposing our staff, our employees, that could potentially expose somebody else. So the trickle-down effect of that. So having real-time data to make decisions, clinical decisions, is essential, and it's all been about the data. I mean, yeah. I constantly get called, text, hey, I have this question, I have that question. Why is this? Why is that? And luckily we've had the tools to be able to provide the information to make the decisions.
And perfect cue, because somebody's asking, and I'm sure you've gotten lots of text messages about this, what is your perspective on the infection rate data trends in the city?
Yeah, it's gone down. It's gone down quite a bit because folks are educated. It's all about educating and understanding, and I'm sure it's hit home to many. Many of us, unfortunately, have lost loved ones, friends, neighbors, folks that we know through this horrific crisis and virus. And once it hits home, you really want to protect yourself, your family, your parents, your kids, and because of that, it's gone down. Now, the fear is, once everything gets lifted, are we going to continue living this norm, or are we going to go back to our old ways? Hand hygiene at Jackson, I mean, we can't keep up with the replacement of the sanitizer. Before, realistically, a lot of people weren't as concerned. Visitors would come into our organization and not worry about washing their hands. Even the patients themselves wouldn't worry about washing their hands. As caregivers, we do. It's part of our day-to-day. But many folks entered our organization and didn't really care. Now they care.
Yeah. Wow. So, question about information security. How are you tackling end user education from a security and compliance perspective? How formal and how much are you spending on cybersecurity end user education?
Well, from a budget dollar perspective, I can't tell you right now off the top of my head, but we consist of a small team of 5 individuals, but those 5 individuals are strong when it comes, and our entire IT division really is very focused on security. But from an awareness program, we also team up with our privacy officer and our compliance team to be able to educate our different facilities. So we do roadshows, and we have newsletters that go out where we offer quick tips from a security perspective. And then when we do the intentional phishing expeditions on a quarterly basis, immediately if someone falls for something or something happens, the education is offered electronically. So if they click on it, or if they put in the credentials, immediately they get real-time feedback. In addition to, we know who from the report. So we do dedicated one-to-one education on those employees to let them know the reasons, because we could have taught the entire organization 3 months ago, but we constantly get new hires. We constantly get new residents. We constantly get new doctors coming into our organization. That it needs to be a daily battle, and the awareness program has to be maintained and dynamic constantly.
Okay, so the questions are coming still. So moving on to the next one. So, Jackson Health System, you guys were very innovative during this period. Let's talk about telehealth, especially those inpatient telehealth solutions. Do you think that these tools will be used post-COVID?
Yes, as a matter of fact, we and the county both agree that this is something that we should have go forward. And not only for us to be able to take care of the patients, but for the patients to be able to communicate with their loved ones. Since no visitation was allowed in many of these areas, and eventually no visitation at all for the safety of the patients and the employees, patients were alone in the hospital. And we wanted to make sure that they had a method to be able to have some kind of video conferencing with their loved ones. So they weren't alone. And if they couldn't with their loved ones, at least they could do it with our caregivers, or with our doctors, with our nurses. So we felt that was extremely successful. It was a lesson learned for us, and we want to pursue that. So Jackson will be placing in 1,000 beds these types of solutions for patients to not only be able to communicate with their providers, but also be able to communicate with their family members.
Wow, that's really fascinating. So there's a question about the workforce redeployment tool. Provide, request, and match talent is understandable. The HR aspect, interesting. Can you expand on the talent self-assessment?
Yeah, so the employee goes into an app and fills out a form and states their skills and how they could help, how they feel they could help. Their manager looks at it and is able to see and judge whether it's accurate or not, and then provide that and say, hey, I have this talent available. I'm only utilizing that talent 50% of the time, or I could share that talent with some other area. And people that are requesting for talent that's available are able to see those skills, see the forms, see the capabilities, and HR is able to match the two to see if we could reallocate those staff members. Now, less and less due to the being on the other side of the curve and going back to our norm. Now we're starting to take on some non-emergency cases, and patients are going back because the tumor is not going to stop due to COVID. Your spine pain is not going to stop because of COVID. Patients were able to wait for a little bit, but not forever. So we need to be taking care of non-COVID patients too, right? That's what we did prior to COVID, and we very successful at it, and we want to continue doing so.
Great. So last year, when we sat down with the organizing committee to think about the theme for the conference, we came up with the theme evolving human and organizational practice in the intelligent age. Not even contemplating that something like this could possibly happen, a pandemic where AI, machine learning, and innovation would be so critical. Michael, you've really highlighted how the IT professional, the information system professional in the hospital is right there on the front line with clinicians and other healthcare professionals.
Yeah,
okay,
no doubt. We have clinical informatics specialists, which we call our clinical informatics coordinators, that are hand in hand with the doctors as we're making changes. And they're in PPE gear, they're holding the nurses, holding the doctors' hands side by side with them. We've had teams that have not stopped being on campus from a technology perspective. And we have our field ops teams, we have our diagnostic teams, we have our informatics teams that need to be helping our healthcare workers, frontline workers, holding hands elbow to elbow, side by side with them.
So what's the next step? What's the next step for this very cohesive, highly skilled, proficient team? What is the next step for this data-driven analytics culture that you have created at Jackson?
So leveraging our real-time platform, as we talked about Overwatch and doing the surveillance, there's many things that we want to become more predictive with, and using our models, whether it's just to predict an pneumonia, to predict if a patient's going to have some kind of infection, because all the data is flowing through. We know the patient's lab results. We know the documentation that the nursing is doing on the patient, so we know if the vital signs, if the blood pressure, if the oxygen level. There's many things that we could aggregate and correlate in real time and build algorithms. So one of the things that one of my professors at FI used to always tell me is, if you have a sensor and you have logic, you have artificial intelligence. So we definitely have sensors out there, and we're building the algorithm to be able to become and do more with the data in real time. We don't want the data and the report to come in 48 hours later, 24 hours later, because chances are that patient already left our emergency room. Most of our patients come through the emergency room, and we need it real time. Knowing that a patient could have potentially had something after they already left, it doesn't bring value to our community, it doesn't bring value to our patients. And we want to bring value and maximize the value that we offer our patients at Jackson.
Wow. I think, that this is such a great example of how we can use technology to add value, not only to our organization, but just to society. So if there aren't any more questions, do you have any closing remarks, Michael?
No, I just really, truly can't be more proud of our community as we responded, knowing that in the state of Florida, we have over 22 million, citizens, residents, in our communities, and especially in South Florida, and the way that everybody has really come together, and then bringing it home when it comes to Jackson. I'm very proud of my team, very, very proud of my organization on how we dealt with the pandemic and continue to deal with the pandemic on a daily basis. We just hope to be able to continue leveraging the technology moving forward for this pandemic or the next, or just the day-to-day patients that we take care of, because it's not only taking care of the next pandemic patient, but it's really taking care of the patients that need us. And that's what Jackson for over 100 years has been able to do in our community. It's a staple, it's a need in our community, and I'm just so proud to be part of it for so many years. This month I turned 14 years at Jackson, and thank you. And 24 years on that campus, and just so very proud of everything we do.
And I'm sure that the South Florida community is very grateful. Okay, so at this point, thank you to our audience, and thanks for being so engaged and attending this keynote this afternoon. And just a few housekeeping announcements for Conf-IRM 2020 attendees. Please enter the sessions for this afternoon through the Conf-IRM 2020 website. Our Zoom sessions have been refreshed and the links have been updated. Enjoy the rest of the conference, and see you at the closing session this afternoon. Good afternoon, everyone. And thank you again, Michael.
Thank you all. It's been a pleasure.